You're listening to Innovators, the podcast from Harris Search Associates, where we speak with global leaders in education, research, engineering, and the health sciences, and ask them to share lessons learned as they continue to advance the frontiers of innovation and discovery. Today's podcast will be led by Rick Skinner, Senior Consultant.
Charles Taylor was named Provost and Executive Vice President for Academic Affairs at the University of North Texas Health Science Center in August 2018. He remains Dean of the UNT System College of Pharmacy, pending a search for his replacement. Before joining North Texas in 2017, Dr. Taylor was the Chief Academic Officer and Dean of Pharmacy at the Northeast Ohio Medical University, or NeoMed, after serving as Associate Dean at the University of Minnesota and then St. Louis University. He was Vice Chair of Pharmacy Practice at his alma mater, Auburn University, where he earned his undergraduate and Doctor of Pharmacy degrees. Dr. Taylor did his postgraduate residency at Duke University and earned a certificate in management development from Harvard. We at Harris Search Associates have had the pleasure of working with Charles, and we know him to be one of the most effective collaborators working with other persons and institutions, but also as a creative leader in healthcare in his own right. Charles, welcome to Innovators.
Thank you. It's a pleasure to be with you today.
Let's jump right in. Let's begin by looking at a big picture of academic healthcare and the professions in which persons are trained and educated. To be candid, someone looking in from the outside, the landscape appears especially challenging. Some examples. We continue to see an insufficient number of healthcare practitioners, especially in certain parts of the country, and in particular in rural areas, but also especially in certain fields such as primary care physicians in the field of geriatrics. New emerging specializations in fields such as lifestyle medicine, nocturnalist, and bioinformatics, just as a taste for what's coming. We're also seeing the creation and establishment of new medical schools, including a number of osteopathic medical schools. We see continued pressure, perhaps unending pressure for containing healthcare costs. And we also have yet to fulfill the promise that was to be interprofessional education and training for everyone in the health professions. By any standard, this is a rather challenging environment. But what do you see as the principal levers for addressing these challenges in the near term, say 5 to 8 years?
You make some excellent points. I think that the education of our next generation of healthcare professionals is quite complex. One of the levers I think about, which would be nice, is to have a more cohesive national strategy for address workforce shortages in healthcare. We know that the reliable access to quality, affordable care is not available in many areas, and for some very specific populations. So then I think it's left up to regional and local leaders to then explore what are those strategic elements that would help address the health needs that are emerging in our local communities. And I know from the standpoint here at our Health Science Center, that's what we're focused on how we look at our strategy, and we're focused more so on that primary care and the needs of our community. So I think that's one lever is if having a strategy on a broader sense for dealing with shortages in the emerging healthcare needs. I say the second lever, which you touched on, is how we educate our providers of the future. At UNT Health Science Center, we're focusing on transforming and creating, improving. We have the privilege each day to think about how to transform our lives of our students, and so that they can go out and transform the lives of others. And that's meaningful work. And if you think about that as a multiplier effect, they impact to a great extent families, communities over decades of of periods of time in which they are practicing as a healthcare provider. So,
Mm-hmm.
so what is it we could do a little differently perhaps in that space? For us, it's important to reform the training and education. For example, we think about our healthcare delivery and in the shift from more of that care taking place outside the hospital.
Exactly.
Have we kept abreast of that with our educational model? We're seeing another example, quite a bit of technology that's used today to virtually connect people and producing points of access to information. So how have we woven that into the educational model? So I think it's our opportunity also to reach out and partner more carefully with those who are delivering care in ambulatory, rural, and community sites, and then shift our model into those environments, but doing it where we're together partnering on a team-based approach. I think it'd be helpful if there's more federal dollars available to help train physicians and health professionals in a more community-based model. But I think when it comes down to it, each of our programs should spend more time thinking about defining and producing the provider of the future. For us, we look at across our multiple schools and colleges the very specific dimensions that we want to weave throughout our program, because we believe student success can be defined a little differently. We want student success to be individuals who graduate who are emotionally intelligent, team-oriented, community savvy, leaders ready to influence change.
Charles, let me follow up on something that you just said. The role of the federal government. It's from a layperson's point of view, it seems to wax and wane. It seems to come and go. Is that inconsistency a part of the challenge?
Oh, absolutely. I think if you can count on investment, and it really is an investment on our healthcare strategy for workforce, then you can begin to plan and build and really look on the long term of how you implement that strategy. So I think having consistency with that investment on the federal level and state, local level is quite important. We see quite a bit of attention placed on other dimensions of how we deliver care, but not quite as much focused on the workforce. How is the workforce innovative? How is it distributed in ways that is impactful into communities who really need access to types of providers, and making sure it's a team approach, that we're building models that are making much more of an interprofessional collaborative practice model.
Just a quick comment. Maybe a couple of months ago, we had a conversation with Dr. King Lee, who is the founding dean of a new medical college. It's a product of Carle Health Systems and the University of Illinois. And they are very deliberate in bringing to bear engineering and medicine together. And when I asked Dr. Lee, I said, is the rationale for that, at least in part, because engineers have long had the tradition of working across lines? And he indicated he did. So it sounds as though you're moving in a similar direction, maybe not with engineering, but it's this notion that you have to have a group of people who in one way or another see the patient as their primary focus and don't worry about their specializations. Did I get it right?
Oh, absolutely. I think you nailed it. We are seeing the blurring of professions as we think about what, at the end of the day, do our individual patients or families or communities need.
Yes.
I mentioned technology, so there could be blending of medicine or pharmacy and technology components. You mentioned engineering. There are so many areas, and I think it starts by focusing on how we can deliver the best care possible, and then who are the team members that need to be assembled to make that a reality.
Let's talk about Texas for a moment. You spent now a couple of years in the Lone Star State, and it may take you a little more time to grasp all that state is. But Lawrence Wright, the writer, himself a Texan, he wrote a phrase that I really loved. He says, subtlety is a quality rarely invoked for anything to do with Texas, which I thought was a brilliant way of putting it. And so I'm certain you have some impressions about Texas and what that means for your work. So if you're in your particular position, how important are these partnerships you've alluded to in order for the University of North Texas Health Science Center to fulfill its mission? How important is partnering with other institutions, other entities? How important is that?
Oh, I believe it's one of the most important things that we do. There are definitely features and characteristics of the state of Texas, as you point out, that impact how we deliver on our mission of providing quality care to the communities we serve. If we just step back and think for a minute, what comes to mind? Geography. So obviously Texas, if you just look at the surface area alone, we are one of the very top largest states in the country. We happen to be one of the most populous states. And that growth has been steady year after year. Now that growth is occurring in pockets more so than in rural areas. Dallas, Fort Worth, certainly one, Austin, Houston, San Antonio. It is causing a shift in movement from more rural areas to urban communities. And so it's important that we understand where our shifts of population, where it's taking place. We also, can continue to see a population which is growing much more diverse. And with that, diversity presents unique needs. So I think these features create a tremendous challenge that we need to stay abreast of. While some cities are perhaps struggling to keep up with the growth of these expanding services and healthcare to support a very rapid growing demand, we have dozens of rural Texas counties who have no or very few primary care doctors, hospitals, pharmacies.
Oh my goodness.
Many may live even more than an hour or so from basic medical care. And so to me, this explains a little bit further what I mentioned before, why our health science center is focused on addressing needs that are unique to our local and regional area. So we definitely have an emphasis on rural and underserved community. In fact, our College of Osteopathic Medicine is one of the highest producers of primary care physicians in the state. Our models of education is a very interprofessional one, but it definitely looks at a more primary care component. How do we use, for example, telemedicine to extend that medical care and accessibility into rural communities, while we also play a role in thinking about the issues in urban areas. So, sometimes I think people forget that there are unmet needs, whether it's in urban or rural. And for us in Texas, we definitely have to pay attention because we have medically underserved areas that cut across these various dimensions.
Charles, let me jump ahead a little bit in something that I was going to wait to ask, but I think everything you talked about sort of indicates that this may be an extraordinarily important question. You're talking about collaboration, and you and I both know that sometimes much of the interaction between institutions is more competitive than collaborative. So you're going to hire a number of people who will have leadership roles there at the center. Tell me the attributes, given all that you said, tell me the attributes you're going to be looking for in people who are going to take on leadership positions at the university.
Now, that's a great question. It's important, I believe, to recruit and retain, the best and brightest individuals. And, our people are among the greatest assets we have. And for us here at the Health Science Center, we took a values journey a few years ago to really explore to us what's our true north as it relates to how we serve our communities and what really guides us. And I truly believe it transformed us in a way that we've now incorporated that value-based element into our recruitment process. So for us, we have to believe when someone applies or is looking at joining us that they have the credentials and experiences in terms of competence and so forth, but do they match up with, for us, the values that we know are really important in driving us toward that vision we have. And so for us, we certainly see service of others first as a key component. So we want to see how has someone encouraged growth and well-being and success of each other in their background. We obviously look at integrity and upholding the highest ethical standards as a component of what we look for. Definitely respect, treating everyone with dignity and compassion is important. We've already touched on collaboration. How do we work together to achieve our shared goals? What examples have you given that you're able to do that, and in ways that recognize the contributions of others and help celebrate their successes? And then at the end of the day, we want to be visionary. We really want to create innovative solutions and kind of respectfully challenge the status quo, the way things have always been done. So I think we weave that together in a way that we pose questions to see how you line up with what we see as important for us. And I think that's an important piece for success.
Charles, just to follow up on that, how important is it now that someone who takes on an administrative role in an academic health context, how important is this disposition toward innovation and invention? You came to that, you mentioned it last, but I gathered that was one that has a certain centrality to it.
Oh, absolutely. I think to me personally, my view is that we are constantly looking for ways to be better, to grow, to see around the corner. Because if we don't do that, we're not keeping pace, and that's when, as an organization, we become stale and irrelevant over time. So, to me, I believe that innovation component and that vision absolutely drives quite a bit of what we want to do for our future.
And if I take that and then circle back to a question that I think is related, what role does research play at a university that has such a strong commitment to education and service? Is there a role for research at UNT HSC?
Oh, absolutely. I believe at the heart of research is the pursuit of answers to questions. What are the important issues that face us today? That becomes a research question. That creation of new knowledge, the curiosity to explore and to present to the world around us, the results of that help us to continue pushing the boundaries on innovation and forward thinking, and that level of research filters across many dimensions. It could be the research on how we educate, the research on how we implement best practices into clinical care, or it could be, another example would be one of our scientific teams who are seeking to discover a new drug for perhaps a condition that has no cure. So there's a wide variety, but at the end of the day, it's about producing new knowledge. And that is the heart of what a health science center is about.
And it's also a significant challenge to undertake in a time when the resources are in some cases very tight for that.
Oh, absolutely.
I want to come to something that in our research for this interview, I think some of us were quite surprised by. There are visions, some might say stereotypes of Texas, that I don't think are quite, they don't resonate with reality when you start looking at some interesting data. And I'll just use a few. Houston, Texas, for example, is home to 142 spoken languages. 140. Now, if you'd said that of Southern California, I would have said, of course, sure. Maybe New York City even. But I don't know that many people make that quick association that the people who've been going to Texas and to Houston are coming from all over the world, not just from within the United States. At the same time, 3 of the most populous cities in the country are in Texas. And each of these is much more diverse than white, African American, and Latino Hispanic. So with that in mind, how does diversity translate into expectations and demands on your university?
I think that's a wonderful perspective and very insightful comment. To me, diversity plays an incredibly important role. Again, I go back to our values is, we are here to create solutions for a healthier community. That means we need to know what are those needs today, what are the emerging needs, who are the individuals, the families, the populations that are in our community. Because at the end of the day, a lot of times we talk about, in healthcare, we talk about the quadruple aim, the idea that we want to achieve better care, better health at lower cost, and of course, greater joy for the clinicians and staff who are delivering that care. But there's a big assumption there. The assumption is that's directed at a community in which you understand what the dynamics are. And so at our university, when I look at the communities we serve, we certainly have affluent as well as the medically underserved and everything in between. And I do see opportunities for us to deliver care in a better way, as we always seek to improve what we do. We seek strategies, just one example, to diversify our pipeline of students who are coming wanting to be a provider of the future to our schools and colleges. I think about our College of Pharmacy, for example, where 65% of its student body comes from diverse backgrounds.
Fascinating.
We know that we need to take a fresh look at how we recruit, how we inspire the next generation of healthcare providers, develop student success programs, creating a bridge at which, as they come into our programs and they're successful, they're also engaged in the communities in ways that make a difference. Because we know that oftentimes when you create access for individuals to be a healthcare provider, and perhaps they feel at times there's really not a chance that I get to be a physician or a pharmacist, but having that bridge to being a health professional, oftentimes research shows that those individuals will go back into those communities to be a provider of care. And that's where we need that access to quality care. I believe this in turn will help us reduce health disparities that are associated with things like socioeconomic, geographic, race, or ethnicity factors. So to me, it's very important that the university pay close attention to the translation of care and education and engagement into our communities, because we know, particularly here in Texas, that it's a community that is growing with diversity, and it's very important that we customize the services that we provide to address those needs.
It's interesting to think about the fact that along with perhaps California and Arizona, Texas has probably lived with diversity in some ways longer than most places, except maybe the American South, because there's always been diversity in Texas. And so it's good to hear that the sensitivity to that and the design and orientation of programs. So let me ask a final question, but I could go on with quite a few more, but let me close with this question. Your job, I think, obligates you to think about a future of your organization. And you have to think in 5, 10, in some cases 20, 25 years in the future. And that's a particular challenge when you're involved with a field such as medicine and the health professions that is undergoing such rapid change. When we interview you 5 years from now, what should we expect to see or hear that's different than what we see today?
Oh, I think that's a great question. I hope when we sat down to talk in the future, we'll be talking about how did you do it? How did you pioneer a thoughtful plan that defines and produced, the providers of the future, that we were attuned to those characteristics of a provider, and we have woven them thoughtfully into our student success model. And now they've gone out as a multiplier effect and are championing that as emotionally intelligent, team-ready, communication-savvy leaders and leading change that produces positive outcomes for our citizens. I think it also will hopefully be a conversation where we talk about where we created innovative new models for addressing community needs around healthcare delivery. I think those solutions for a healthier community will speak for themselves and be a hallmark of the success that came about with a lot of dedication, hard work. But I think at the end of the day, it requires focus. For us, we would say that we're built on our values. We're really energized by remarkable teamwork, and have laser-like focus on achieving this on behalf of the communities we serve. So that's what I'm hoping in 5 years, 10 years, 15 or so that you and I are talking about at that time.
I suspect we will. And one of the reasons I expect that is that we've had the good fortune of knowing you in more than one role at other institutions. And the two things that always strike me is your willingness to look at things in a collaborative point of view, and the fact that you never lose sight of what the end is. So I have a feeling in 5, 10, or 20 years, we'll be having a conversation, and it may very well be, how did you do that?
Well, thank you. I look forward to that day.
Charles, I cannot thank you enough for this. You're a very busy man. We wish you the greatest success, and thank you for being with us on Innovators.
Oh, you're very welcome. It was my pleasure.
Thank you for listening to Innovators, a production of Harris Search Associates. We'll have more insightful conversations with global thought leaders to follow.